And I believe I counted 3 members that have logged in already. I have Evan, Teddy's, and Anlin. So if I missed anybody, let me know. It looks like we've cleared. Oh, there's Susan. There we go. Sorry, Susan, I didn't see you log in.
It's okay. I'm here now.
I do, before we start really quick, I want to give a few friendly reminders to anybody who's new to the TAC meetings. If you are not a committee member, you cannot vote on the minutes or recommendations. We've had some things popping up in some other TAC meetings, so just a friendly reminder. Also, for the court reporter's sake, when you first start speaking, if you could identify yourself and who you're with, you know, if you are, say, with an MCO, just who you're with, and to please try to speak one at a time so that the court reporter can capture everything for the minutes and for the transcript. So I just wanted to throw those couple friendly reminders out of there. We have cleared the waiting room, so if you're ready to begin, I will turn it over to you.
Thank you. Good morning, everybody. We'll start out with the introduction.
Counties that had a separate DUNS number, sheriff's department, and one for the highway department, and one county.
And I'll go ahead and start with the introductions. I'm Anlin Purdon. I'm the executive director for Hazelwood Home Health, and I'm also with the Kentucky Home Care Association.
Susan Stewart with Appalachian Regional Healthcare and the Kentucky Home Care Association.
David Perez, Green River District Home Health Administrator. I'm with the Kentucky Home Care Association, the Kentucky Public Home Health Alliance.
Executive Director for the Kentucky Home Care Association.
So I believe that's all of us that are on today. So we do have a quorum because there's 4 of us. And the next item is approval of the minutes. So it looks like we won't get the actual short minutes anymore. We actually get the whole transcript. So I don't know, do we want to go off of that and everybody read and approve that, or do we want to do our own minutes from here on out? What's everybody else think?
I'm fine with the full thing. That's what we get with the MAC as well.
Okay.
Yeah, me too. I'm fine with that.
Okay. Sounds good. Does anybody want to make a motion for to approve the June 21st, 2022 minutes?
I will. Susan Stewart. I make a motion.
I'll second.
Go ahead.
So we have Susan and Evan second. All in favor, say aye.
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 Aye. All right. So I believe we are on to old business. Evan, you want to take over?
Sure. We have 3 items here, and really just touching base with DMS to see if there are any updates. You know, home health reimbursement rates were under consideration the last we had heard. And I think there was some work going on both on the supply reimbursement rates and policy changes there. And likewise for the publication on the supply limits and standardizing those. So just wanted to have a check-in with DMS and see if there's any updates on any of those items.
Do we have anyone from DMS that can give an update on that?
Hi, this is Leanna Trainer. I can speak a little bit about it. We are still working on making modifications to both the home health and DME schedules. Right now, that is with our systems team to put those requirements or put those changes in place for us to be able to make those payments and reimburse providers. So right now it's still in the works. We probably expect at its current phase that it'll probably be another couple of weeks before those are completed. But once they are completed, I do know that I'm working with our policy team and we expect to send out notification to the providers.
All right. I don't know if we have any questions from the group or anything further, but it sounds like things are still in progress on DMS's side.
Yeah, so everything's still in progress. And if anyone does have any questions, feel free to reach out to me. Again, it's Leanna Trainer speaking. And if I don't have the answer, I'll certainly find it for you.
All right. Think we're ready for the next one then, Anlin?
Yes.
And this one's just an update on the EVV delay request. I know some states are kind of just submitting, but we had spoken about this last time, so I wanted to see where things stand as far as the state submitting its good faith effort delay request to CMS.
Looking to see who gave the update on that last time.
I don't know if it was Lee, was it Lee Geis maybe? Or was it, I think her and Pam Smith were the two main individuals that we communicated with the last meeting.
Are either of them on the call today? Or I know Lee isn't because she's retired. I'm sorry,
Right.
but is Pam Smith on?
I'm scrolling and I don't see Pam on. I can let you know that Nicole Bradshaw is our new director of policy. So I can always send her a follow-up with that and ask her to look into that for us.
That would be great. We'd appreciate that because that's a big one for us to make sure that, you know, we can plan appropriately if there is going to be a delay or not.
Pam is logging in currently as we speak.
Okay.
Excuse me. Pam is logged in if you want to run that question by her again.
We're morning, Pam. We're just looking for an update on the EVV good faith effort delay request to CMS. If there's been any additional updates on that.
For the home health, we have not submitted it yet. We are still planning to submit it. I'm targeting submitting it in September after I have, we're still in open procurement, so I can't say a whole lot about that, but I was delaying our submission until I had a little bit more information. So, but it will be submitted by the end of September.
Okay. All right.
Thank you.
Then we're ready for the general discussion, Anlin, if you want to take that.
I had a few other items on my agenda. Yeah, the one that she has up. Did we do the supply reimbursement rates and policy changes?
So I can't speak on behalf of the MCOs, but as you all know, I have just taken over home health. And so in July, and then as Lee retired. So I don't really have an update other than to let you all know I am really looking into this, and hopefully by the next meeting I'll have more information that I can share. But I'm kind of going back to the start and some other initiatives that I worked on actually prior to this role, in particular related to supplies. So I'm kind of recycling some of that, and hopefully I can have a better update for you all at the next TAC meeting.
So I'm sorry, this is Anlin. Are you speaking to both of the supply reimbursement and supply only to DME and the limits for the MCOs?
So I'll have to work with, and I don't know if Edith is on. See, I do not see, looking real quick to see, I don't see,
I don't believe she's on, Pam.
I don't see anyone from that division on, but I'll work with that division director, and because I don't have while we work with the MCO, since most of what I do is on the fee for service side, but I'll work with the directors on that side to address everything under this. So MCOs and just in general, the items under this old business bullet here.
So is it safe to say that none of the MCOs submitted their supply list and quantity limits?
They have not to me, but that does not mean, but again, I'm not over their contracts, or that's not part of, that's not directly under my purview. So it's not abnormal that I would not have seen that, or that they would have not submitted that to me. So they may have. I don't know.
I think from the last meeting, they were supposed to, or some of them said they would send it to Aaron and maybe to Evan also. So Evan, you didn't get any? No.
And I'll
Not
double
from
check
my end.
my records, but I don't recall getting anything. I try to send that out within a week of the meeting, but I'll double check my records for you guys too, just to make sure I didn't drop the ball there.
And I'll send an email on this to Angie Parker, because I think
Well, it's not Angie. So that while Angie is still assisting that division, the MCOs are no longer under Angie. Aaron, if you'll help me follow up with Edith and Malia, please.
Hi, this is Holly with Anthem. Our regulatory team sent that out by the due date that was provided. I'm not sure who the regulatory team sent that out to, but they did send it out to whoever requested that it be sent to, and it was sent by the due date.
Thank you,
This is Chris
Holly.
Kern with you, with
Holly,
United Healthcare. We did the same thing.
I'm going to throw my email in the chat. If you all don't mind, if you all will have whoever from your teams forwarded that out, if you can just have them forward me a copy of it, that would be great. And we'll try to figure out kind of where it just sounds like there's been some miscommunications and maybe some just misunderstanding. So we'll get all of that resolved and get it and get us back on track. So.
Okay. Pam, yeah. Pam, would you be able to email our regulatory team?
Yes, if you can send me who the contact would be, absolutely.
Okay, thank you.
This is April Evans with Humana Healthy Horizon. I just wanted for the record to state that I also was copied in on the email that we had forwarded that requested documentation as well in a timely fashion before it was due. So I just wanted to notate that we did that as well.
Thank you, all of our MCO team members that are speaking up, and I apologize. It just looks like there's been just some miscommunications on our side. So we'll remedy that quickly and take care of that and get us all back all on the same page and get us moving forward.
All right, thank you. Okay, I believe now we're ready for the general discussion, unless anybody has something else to say. All right, I believe the first is updates from the MCOs, if there's any.
Good morning. This is Chris Kern with United Healthcare. I'm a new attendee to this meeting. I'm the network provider director for United Healthcare. I do have a short update that I could share with you. If it's okay if I could share my screen.
You should now be a co-host.
Thank you. Can you guys see my screen?
Yes.
Okay. So thank you again for the invitation, the opportunity to come and talk with you guys today. Look forward to many more opportunities to work with you. Want to give a prior authorization update. We have some skilled nursing and home health aid codes that can be administratively approved under standard guidelines up to 10 visits in 30 days with a signed order from the ordering physician. The list below is not an all-inclusive list. If the request is over the above limits, then request clinical information and we will pen the case for further review, and we will request that additional information from you. If the provider requests more than the above, we do review for medical necessity and send it to the medical director for review. As most requests for a large number of visits, that's pretty standard for United Healthcare. The medical directors normally would deny based on medical necessity or based on recommended number of visits in interqual. Again, if we have any additional information we need, we would reach out to you via email. Wanted to also, we're always recruiting providers to join our network, and home health is no different. I did place the United Healthcare Join Our Network link on the Kentucky Community and State United Healthcare page. You see Join Our Network is the third option in the drop downs in the middle of the page. If anybody has any questions about that, they're certainly welcome to advise us, or also if you have a relationship with your network manager, or also network help is an option when you drop this down. Any of those three would work. Claim updates. I did ask for a top 5 denial by home health claim type from 1/1/22 to 6/30/22, and the top 5 denials for that time frame. The biggest one by far is member eligibility at 1,062. The next one is pretty much something that almost everybody would see. It's based on your contract, a discounted rate from what your billed amount is. The third one is primary carriers EOB, and that pretty much relates to if you have a private insurer or Medicare that you bill first, we would need to see that EOB with the claim. And then another one is a billing NPI not enrolled or active. That could be as simple as a network update, or if you're not a network provider, just simply getting you into under contract. And then the last denial for that time frame is referring MPI not valid. It could be that there's a transposed MPI, or the MPI is not one that's recognized in our system because the provider may not be a Kentucky Medicaid provider. So we would just want to kind of work with you. If you have that issue, just double check the MPI, double check that the provider is a Medicaid provider. And if there's still some issues, we try to work with you to iron that out. The next item was the quantity limits and supplies. Just wanted to check to make sure it was received. Clearly, as Pam had mentioned, we'll need to send that to her. We did send it out earlier, and I will take care of that post this meeting. And then just the last item, if there's anything in particular the TAC would like to see from United Healthcare, please let me know. I'd be happy to try to add that to whatever I present in the time allotted to me. Are there any questions or feedback that you want to provide before I turn it back over?
This is Susan Stewart. I'd like to see, rejected claims, denial percentages, and for, not NPI, not the things you listed here, but other reason codes.
Denial percentages for other reason or other denial reasons.
Right, and I would be interested in looking at audit denials, post-audit.
Post-audit denials.
Susan, can
So
you work through maybe Evan or Anlin to make sure we get everything, maybe formalize the request and just send something in writing. And I don't know, maybe all have done this, but I just want to make sure we get everything and don't miscommunicate or anything. So we can, that way, if we have maybe one after the discussion, if everybody agrees on everything, then we can formalize it and everybody agree in writing that the request includes everything. And hopefully that way we'll get you all everything that you're wanting to see. If that's agreeable to everybody.
I think that sounds like a wonderful idea.
And that's fine with us. That way we're consistent. Fine with me, that way we're consistent across with all MCOs.
Yeah, this is Anlin. It's fine with me too.
Well, thank you for your time today. I appreciate that, and I look forward to working with you in the future. Have a nice day.
Thank you, Chris. Any other MCOs? Okay, looks like we'll move on to updates from DMS.
Sorry, I couldn't get to my unmute button. It's a hazard of I've rearranged my desk and somehow my screens have rearranged each other. And so I couldn't get to my mute button. So a couple things with waivers, the Appendix K for the changes we did related to the flood disaster in Eastern Kentucky, that was formally approved by CMS. And I believe yesterday afternoon, the guide went out that highlighted those changes. Those of you that worked within Eastern Kentucky, or Western Kentucky, sorry, in Western Kentucky, when we had the tornadoes, you'll notice a lot of similarities. It's a lot of the same flexibility. The 10% rate increase for the 1915C waiver. So the HCBS providers that was included in the approved budget, that the direction was to use the ARPA funds for that. And so we modified the spending plan per that direction. And that is with CMS right now, awaiting final approval. And so we are, as soon as we hear back from them, then there'll be more information coming out about that. Rate study for any of y'all that have been participating on those calls or have been following and watching the webinars. We have not had a meeting we did not have a meeting in July and August. Part of that was just it's that time of the year, vacation time. It was time to allow us to focus on the floods. We are looking at the next meeting starting back again in September. So didn't want anybody to be concerned that the rate study was not continuing because that is going to it is a continued focus and will be happening there. I think those are the biggest things right now that are going on. As I mentioned, I'm really trying to kind of get my feet wet again with the home health and private duty nursing. It's something that Susan, I know you that I've had done a long time ago, have been involved in a long time ago, stepped away for a little while, been focused mainly on waivers, but I'm now trying to get right back into the swing of things. So if there are any concerns or things that I may have missed, please reach out to me. And I put my email address in the chat, so reach out to me, ask the questions, remind me if I've missed something, and we'll try to make sure that we can kind of get everything back on track and start answering those questions. And I guess on the data requests too, are you all also wanting to see, I know in particular you're wanting to look at the MCO data. Is that something you also want to look at on the fee-for-service side? Is there any data that you want to see on the fee-for-service side in particular? So include that in your request if there's something that you want to see on the fee-for-service side, or if you want the same data points, or if there's something different that you want to see.
Thank you, Pam.
Mm-hmm.
All right.
And I have a quick update. I apologize for jumping in. This is Erin DMS. I had reached out to Angie because she had to be on another call today. We did receive the MCO's information from the last meeting, but there were some concerns on some of the things that were being asked for. So DMS is currently reviewing that to make sure nothing is being sent out that's against CMS policy. So Angie Parker is reviewing that, and I will have her get with Pam and provide all that stuff with Pam as well, since that's now her wheelhouse. So we do have that information from the MCO, so thank you, but it is under review currently just to make sure that DMS is doesn't get in trouble with CMS.
All right, thank you. And do we have updates from Commissioner Lee or her representative?
Believe she was able to attend, and I do not believe there's any other additional updates. I don't think that she had passed along for us to give as well. So
Okay. I believe that brings us to recommendations, which I don't think we actually have any formal ones. Did you want us to talk here about what we would like to see from the MCOs, or and formalize it here, or separately and then submit the request?
I believe it would be okay to discuss it now, so that way they're aware of what you would want from them, so that they can have that prepared for the next meeting or by the deadline.
Okay. So Susan, you want to give your list again?
I wanted to see rejected claims percentage. Like if we send 100, if they get 100 claims, what percentage of them are designated as clean claims or rejected? And if they're rejected, what's the primary reasons they are rejected? And then I wanted to see at post audit, what are the percentages on denied claims?
And actually, I would like for the MCOs to tell us how they handle their post-pay audits, especially when they contract with another agency to do it. Like, does somebody within their company oversee those, or who you complain to when you don't think the company they hired has done the audit right? Is there any questions from the MCOs about those requests?
Could you repeat those items one more time? I'm just trying to jot them down. I want to make sure I have a complete list.
Rejected claim percentage.
Okay.
Post-pay audit denial percentages.
Okay.
The top 10 reasons for rejected claims.
And I was trying to think of how to condense everything I said. I guess if the MCO outsources their audits, how they handle the company that audits for them. So I'm trying to think if any of the Medicaid MCOs outsource their audits. They might. I get so many audits, I don't know who they're coming from. All right.
This is Holly with Anthem. Will a formal request be coming to the our regulatory folks?
We can jot it down on paper and send it over if that makes it easier.
It does. That way they can coordinate and get it to whoever needs to answer those for you. That would be much appreciated. Thank you.
Thank you. All right. So we have the MAC meeting representation. Is that an update, or is it just on here to say that we have a MAC representative here?
Yes, that's just to let me know. So when they start going through the different TACs, if someone is not going to be there to represent you, I can let them know. So that way they can just sitting there in silence.
I was not at the last MAC meeting. That was the flood day.
Otherwise occupied?
Was on vacation. That ended early too.
All right. So as far as you know, will you plan on being at the next MAC meeting? All
That's
right.
the first one I've ever missed, so yeah.
I think that was good reason. All right. I believe our next meeting is October 18th. Sounds good. And is there a motion to adjourn?
I'll make that motion.
Second.
All in favor?
Ah,
Thank
Aye.
you. All right. Thank you, everybody. Thanks.
Have a good
Adrian.
day.
Everyone.
Have a good day.
Have a good day.
Have a great day, everyone.